luxury. If someone is suffering from a problem, if you make him normal, it's a luxury. So I'll take you through my experience where uh, I'll show you some two or three cases, not more than that, but I'll elaborate what I have done in them, what was needed from my end, and what was expected from a clinician point of view, and how what kind of a difference it translated into patient's overall life. So, as a urologist, I always used to believe, as long as I was preparing for urology and all that, eventually when I start practice, I'll be doing only stones and prostate. That's what most of the people believe. Of course, there is nothing to brag about it. My bread and butter is stones and prostate. Out of my 75 to 80 cases that I perform every month, 50 are around stones and prostate. That's how I make money. That's how I reach to most of the people. That is how I'm known for. That's what I'm known for. He's a stone doctor. He's a prostate doctor. But is it what I'm only concerned about? Is it what I only do? No. There is a lot beyond stones and prostate. And the first insight that came into my mind that it's not just stones and prostate. The foundation was laid in Tata Memorial Hospital when I was doing my uro-oncology SRship. So I'll take you through a few cases. The first thing, let me tell you, you all know what lithotomy position is. Okay? Gynecologists use lithotomy position, GI surgeons use lithotomy position, general surgeons use it, we use it. So lithotomy is just not a term framed out of anywhere. Lithotomy, breaking a stone. So we should go back to 17th century or 16th century, where I have no idea how they would diagnose a bladder stone, but they would barge on to operate on a patient of a bladder stone in this position. They were using this barbaric position. They were using this kind of a butchery to take out a stone. That is how the name came into existence. So this is how a patient would be tied up. His hands and limbs would be tied up. An incision under no anesthesia would be given on the perineum. They would reach the bladder, take the stone out. Just a butchery, simple butchery. And the most glorified barber or the butcher in that area would do that, who is the most skilled with his knives and scissors. And they would take the stone out, they would celebrate it, but 100% mortality. Okay, so they had some vision where they thought not every disease is medically manageable. Some diseases need surgical management. Yes, they had an idea, but they did not have the way to do it. That is how the conception of surgical practice came into existence. So from those barbaric days, we evolved to these days. I'm confining myself to urological history. Okay, so way back in mid 1900s or mid 20th century, people thought no, we should not incise perineum to reach bladder. There is a way to reach bladder without incising as well. So that's when they thought, okay, let us use a scope because it's all a plumbing network. Infamously, we are called plumbers, is it not? Because we deal with the urinary system right from the kidney to the meatus, and orthopedicians are called carpenters. Okay, so so they thought, yes, we should do something without incising. We should reach the bladder through something. So that's when this came into existence. It's called hot light cystoscope, where they would use some form of a channel to enter the bladder. But how would they visualize inside? Because it's all dark inside. Now we have fantastic scopes where there is no, there is a tremendous light, but there is no heat, there is no energy. Patient goes home happily after a daycare cystoscopy. But here it would generate tremendous heat for the kind of energy they use. So what were they using? They were using incandescent bulbs. Okay, so yes, there is some refinement in the absence of, in the place of some incision, they were using some scope, using some form of light to visualize. So humans started upgrading. They started thinking beyond their domains. Yes, we can do something better for the patient convenience. Okay, so from there, from those days, today we have reached to this level where we are using a flexible ureterorhinoscope on a day-to-day basis. Without this, our practice is gone to dogs. Every single day we use it. And this is what we are known for. Stone surgeon, yes, this is what we use. It's a flexible ureteroscope. Even on daycare basis, we make use of it and patients go home happily after getting a stone removed, which is as big as 10 to 15 mm. Okay, those surgeries, those stones, even when I was doing my post-graduation, sometimes my consultant used to, not MCH, in those general surgery days, my consultant used to do a nephrotomy, not nephrectomy, an open pyelothotomy or an open ureterothotomy to remove the stone. But now you don't need to do it. So, from all these days, now I'll tell you what I do beyond this. You have known that, yes, you know that I do stones and prostate. Yes, I do stones and prostate, but I don't do only stones and prostate. So this is the first glimpse of the latest advancement. Okay, so partial nephrectomy is not a new concept. Partial nephrectomy is taking off only the tumor from the kidney, safeguarding the entire kidney. You can see here, this is the tumor. He was a 50-year-old gentleman where he came with an incidentally detected tumor in right kidney. And let me tell you, most of the kidney tumors these days are incidentally found. Very rarely a patient comes with some symptoms like hematuria or swelling in the abdomen or emaciation or cachexia. Those things are like bad old days. Okay, so with the help of Robo, we are precisely able to remove the tumor only, safeguarding the entire kidney. Just look at the precision with which I am able to do this surgery. Okay, as you can see, there are two arms. These are two, my right and left hand operating these two. But what is this? This is the fourth arm that is also being operated by me. Say, these surgeries can be done laparoscopically as well. There is no doubt about it. But what is the advantage of Robo? That fourth arm is also under my control. Number one. Number two, whatever camera thing you are seeing, it's also managed by me. In laparoscopy,